Throughout history, aesthetic treatments were almost unaffordable and reserved mainly for the very wealthy. However, in the last couple of decades, with the advent of non-surgical treatments and improved techniques with accompanying results that are equally impressive, the number of people seeking aesthetic treatments has grown exponentially. This growth has been contributed to by increased attention to facial aesthetics in the press and on social media. Non-surgical treatments are now not only more accessible but affordable and quicker to obtain too, with minimal downtime and minimal trace of their occurrence. With this, unsurprisingly, one of the most popular, effective and sought-after treatments today is that of lip fillers. The history of lip fillers. Lip fillers have a surprising history that dates back to the 1900s. Details of the first attempted lip augmentation were published in 1906, when surgeons tried injecting liquid paraffin into the lips. The paraffin was injected in a fluid condition by means of a powerful metallic syringe, which, together with its contents, was immersed in hot water. As you would expect, the procedure wasn't successful, and so surgeons started looking into alternatives. Liquid silicone was first used for lip augmentation in the 1960s. However, concerns about the safety of silicone on general health meant that this method of lip enhancement was abandoned and surgeons began using bovine collagen instead. Bovine collagen was deemed safe to use and became the standard product for lip augmentation. However, this method was not without its flaws, extra expense and delays. An allergy test was required 3 weeks prior to treatment, and patients would have to wait for weeks after treatment before any effect could be seen. Currently, fillers containing hyaluronic acid are the go-to products for aesthetic practitioners around the world. Hyaluronic acid is a naturally occurring polysaccharide that is present in the skin and cartilage. It is able to combine with water and swell to varying capacities depending on the product used when in a gel form, causing the sought-after filling effect. Hyaluronic acid fillers last between 6 to 15 months and, if injected by a professional with the correct up-to-date training, have very little risks compared to other methods of lip augmentation. The boom of lip fillers. There is currently a steady increase in the number of people interested in augmenting their facial features through the use of non-surgical lip filler cosmetic procedures, but the demand for dermal lip fillers surpasses that of all other treatments. This is undoubtedly due to the role of social media and the belief that larger lips are more physically attractive, with celebrities also admitting to and almost celebrating having had lip fillers and other cosmetic procedures. The culture around these treatments has changed to become more mainstream and accepted. As the UK doesn't regulate non-surgical procedures, there are no reliable statistics available for lip fillers in the UK and their use. However, according to the American Society of Plastic Surgeons (ASPS), more than 27,000 Americans had lip augmentation treatment in 2015, one every 20 minutes. Every day people take to Instagram, Facebook and Snapchat to share photos of the results of their latest aesthetic procedure, and a search for #lipfillers on Instagram produces almost 300,000 results. Women and an increasing number of men proudly post photos of their freshly filled lips accompanied by hashtags such as #lipgoals, #pouty and #Kylie Jenner lips. The Kylie Jenner effect. It could be argued that the demand for lip fillers really exponentially increased back in May 2015. Following much media speculation about her plumped-up pout, Kylie Jenner confirmed suspicions that she did receive lip fillers. Some clinics reported an immediate 70% rise in inquiries for lip filler treatment, and Jenner's lips still remain the subject of discussion even today. Although Jenner's lips prompted the publication of information about how to safely receive lip fillers, there was also a worrying number of botched and dangerous procedures being reported. As a younger demographic of patients sought out cheap treatments, there was and still is an increasing number of people turning to unqualified providers who have not received proper training. Unfortunately, without appropriate background checks in place and in such an unregulated industry, the evidence of these unqualified providers only became apparent upon treatment and after the complications arose. Lip fillers in ancient history. Lip fillers have been around for much longer than most people realize. In fact, their use can be traced back to the ancient Egyptians, who used a mixture of beeswax and damask rose oil to plump up their lips and add volume. This mixture was also used by the Greeks and Romans to enhance their appearance, and it has been found in many archaeological sites. In the Middle Ages, lip fillers were used by members of the royal court to enhance their appearance. They would often apply a substance known as cerris, which was made from white lead and vinegar, to their lips to make them appear fuller. This substance was highly toxic and could cause serious health problems, however, so its use was eventually outlawed. The modern era of lip fillers. The modern era of lip fillers began in the late 19th century with the invention of collagen fillers. Collagen is a naturally occurring protein found in the skin, and it has been used for decades to promote healing and reduce the appearance of wrinkles. Collagen fillers are injected into the lips to provide additional volume and shape, and they are still widely used today. The invention of hyaluronic acid fillers in the late 20th century further revolutionized the field of lip fillers. Hyaluronic acid is a naturally occurring sugar molecule found in the skin, and it helps to keep skin hydrated and plump. Hyaluronic acid fillers are injected into the lips to provide a natural-looking plumpness, and they are considered to be the gold standard of lip fillers today. They might seem like an overnight phenomenon, but lip fillers date all the way back to the early 19th century. Injectable fillers made from analogous fat were originally introduced in dermatology as a way to reconstruct facial deformities in patients with tuberculosis, but despite their somewhat macabre origin, by the early 1900s doctors started performing lip augmentation as a purely cosmetic procedure, although it was an experimental procedure and never quite took off. Since the conception of fillers, surgeons have injected pretty much everything into lips. After fat came liquid paraffin, but that was quickly proven to be a massive fail. Fast forward to the 62nd and silicone entered the scene, giving birth to the trout pout. Results were questionable and potentially dangerous, so the method was quickly abandoned. For a while in the 72nd, surgeons were even injecting bovine collagen, as in beef, into lips. Is lip augmentation right for you? To answer this question, you must first ask yourself why you want to change your lips. You should not have this procedure unless you truly want to modify your appearance. If you are considering lip augmentation to make someone else happy or to try to fit an ideal image, you may want to think twice. Also, it's important to have realistic expectations about the outcome. Augmentation may make your lips plumper and fuller, but you will still be you when you walk out of the doctor's office. Your doctor can discuss with you the pros and cons of your lip augmentation options and help you decide which technique or product is best for you. Before having lip augmentation, you should be in good health and be a non-smoker. You may not be a candidate for lip augmentation if you have an active infection such as oral herpes, diabetes, lupus, blood clotting problems. If you have ever had a cold sore, oral herpes any time in the past, you should tell your doctor before you have the procedure. If you have any known allergies or are allergic to lidocaine, tell your doctor before the procedure. Also, tell your doctor about any medications you are taking, including prescription and over-the-counter drugs and herbal supplements. What are your honest thoughts about lip fillers? Have you had them before? When was it and how did they feel? Or would you intend to? Feel free to share with us in the comment box. Don't forget to like this video and subscribe to this channel. Share our video if you enjoyed it and found it useful. See you in our next upload.